Hi, my name is Sarah, and today I'm going to be discussing the HIV/AIDS crisis from a global perspective, studying the crisis as it exists in different countries, specifically the United States, Poland, and Uganda. So I'll begin by giving a bit of background on each of these three countries, starting with the United States. Here we have a population of about 328 million, and our life expectancy is almost 80 years. Our infant mortality rate is 5.8 deaths per 1,000 live births. Our GDP per capita is about 62,794 US dollars, and our total health spending per capita is about $10,000, which equates to roughly 16.8% of our GDP. In terms of Poland, there is a population of about 37.97 million, and a life expectancy that's very similar to the United States at about 77 years. Their infant mortality rate is lower, however, at about 3.8 deaths per 1,000 live births. In terms of GDP, Poland has about 15,420 US dollars. Their total health spending per capita is about $2,000, and it is equal to about 6.2% of their overall GDP. Poland's healthcare system is inclusive of both private and public sectors. However, every Polish citizen has mandatory state coverage. There's only a small percentage of Polish citizens that do not have health insurance. Private insurance, however, is very popular in Poland, and it can be used as a supplement as well as a replacement for certain services. In Uganda, there's a population of about 42.7 million. Their life expectancy is 62.5 years, and their infant mortality rate is about 33.8 deaths per 1,000 live births. In Uganda, the GDP per capita is $642 United States dollars. Their total health spending per capita is only 159 US dollars, and this is about 7.5% of the GDP. The healthcare system in Uganda is also inclusive of both public and private sector, but there is no consistent insurance available to Ugandan citizens. Ugandan citizens do end up footing a great majority of the bill for their healthcare, and the majority of private healthcare expenditures in Ugandan is out-of-pocket costs. HIV stands for human immunodeficiency virus, and it's a global health problem, though different areas of the globe are disproportionately affected. Currently, about 36.9 million people are living with HIV in 2017. The United Nations Program for AIDS in 2014 launched the Fast Track strategy, also known as the 90-90-90 targets, which say that by 2020, 90% of people living with HIV should know their status, 90% of all HIV positive people are on antiretroviral therapy, and 90% of people accessing treatment have suppressed viral load. Potential treatments and preventative measures for HIV include antiretroviral therapy, also known as ART or ART, as well as pre-exposure prophylaxis, which is also known as PrEP. This chart compares the incidence, prevalence, and trends of HIV cases in the USA, Poland, and Uganda, respectively. You can see in the United States that our total population is about 328 million, and we have about 36,400 new cases per year. We have approximately 1.2 million people in the United States living with HIV, and our progress in reducing new cases has actually plateaued recently. So we have definitely declined from previous decades. We're not making as many decreases as we expect to be. In Poland, there's actually a slight increase in new infections of HIV. They have about 1,419 new cases each year and about 20,000 people living with HIV. Uganda has seen a drastic decrease in new infections. They have about 50,000 new cases of HIV still per year, and about 1.4 million Ugandans are living with HIV. An interesting thing to look at with these three different countries is that each country has a different most vulnerable population. So for example, in Uganda, women and children are disproportionately affected. 59% of adults living with HIV in Uganda are actually women, with sex workers being especially at risk. Whereas in Poland, the greatest affected demographic is men who have sex with men, and this remains the dominant mode of transmission, although people who inject drugs are also a vulnerable demographic. As you can see, Uganda has seen the greatest decline in new cases of HIV. The number of new cases recorded in 2018 was about 50,000 compared to 92,000 in 2010. Deaths have also significantly declined from about 56,000 in 2010 to only 23,000 in 2018. Each of these countries have unique circumstances, cultural factors, and vulnerable populations to keep in mind when they're approaching the HIV epidemic, which means that each of their approaches are somewhat different. The United States, President Trump announced a 10-year initiative called Ending the HIV Epidemic, a Plan for America, in his State of the Union address in 2019. This aims to end the HIV epidemic in the United States by about 2030. It has 4 pillars. First, to diagnose all individuals as quickly as possible. Second, to treat infections rapidly. 3, to prevent at-risk individuals from contracting HIV. And 4, to rapidly detect and respond to emerging clusters of infections. This plan focuses efforts in 48 key countries. This actually includes Cuyahoga, Franklin, and Hamilton County, which are all in Ohio. The Ready, Set, PrEP initiative is a program that manufactures PrEP meds free to people without prescription drug insurance. In Poland, there's the National Program for Preventing HIV Infections and Combating AIDS. This is run through the National AIDS Center. This approach is interesting because there's so much emphasis placed on preventative education in addressing risky sexual behaviors. So this includes attempting to improve sexual education that happens in public schools in Poland. In addition, there's extra emphasis placed on the use of psychoactive substances such as alcohol and marijuana. Poland has high levels of annual alcohol consumptions, especially in young people, which has been shown to contribute to risky sexual behaviors. In fact, 88.5% of 15-year-olds have consumed more than one alcoholic beverage in their lives in Poland. Finally, Uganda is implementing a national strategic plan. The objectives are the adoption of safer sexual habits, scaling up coverage of use of biomedical prevention interventions such as PrEP, and mitigation of underlying socioeconomic factors that cause infection. This approach is unique in that it is greatly focused on changing sexual behavior of Ugandans. We use the ABC approach. A stands for abstinence, and this means that the Ugandan government is attempting to delay sexual activity in young people. B stands for be faithful, which correlates with partner reduction, and C is condom use. This approach has been incredibly successful, and Uganda has been making great strides towards the 90-90-90 targets set by the United Nations for AIDS program. Next, we'll discuss access to treatment and testing in these 3 different nations. In the United States, the prevalence of people between the ages of 18 and 64 who reported having ever been tested for HIV increased from 42.9 to 45.9% between the years of 2011 and 2017. This was incredibly significant in that it resulted in about 4.3 million more Americans being tested for HIV. Still though, about 15% of the estimated 1.2 million Americans living with HIV are not aware of their status. In 2016, about 65,000 people were prescribed PrEP, and this is significant in that it's about a 712% increase from 2014. HIV positive Americans are linked to care relatively quickly. About 75% of HIV positive people began receiving care within 1 month of diagnosis. In Poland, however, HIV positive people are linked to care even faster. About 75% of HIV positive people in Poland begin receiving care within only 4 days of receiving their HIV diagnosis. In Poland as well, the number of people tested is steadily increasing, and there are about 2,200 PrEP users currently in Poland. In Uganda, the number of people tested for HIV is actually massively increased from 5.1 million to about 10.3 million between the years of 2012 and 2015. There are estimated to be about 31,000 PrEP users currently in Uganda, and the government is piloting oral HIV self-test kits that can be used at home. And this goes hand in hand with screening that is often done routinely along with other tests. Other tests include diabetes and hypertension. So we can see that in Uganda, HIV testing is starting to become very routine. The United States, Poland, and Uganda vary drastically in terms of how much they spend not only on normal health care, but specifically HIV/AIDS healthcare as well. So in the United States, we've spent about 5.174 billion US dollars on HIV/AIDS interventions. 11.9% of this spending is focused primarily on prevention, and 13% of all these costs are paid out of pocket, meaning that HIV patients themselves are paying 13% of these expenditures. This is very different from Poland in that only 1% of costs for HIV/AIDS are paid out of pocket. They have spent about 208.6 million US dollars on HIV/AIDS, and they actually dedicate 30.9% of their spending on prevention. Uganda has spent about 1.45 billion US dollars on HIV/AIDS interventions, and 9.7% of those costs have been paid out of pocket. Uganda kind of falls in the middle of the United States and Poland in terms of how much resources they allot to prevention. They have about 22.1% of their HIV/AIDS spending on preventative measures. The United States, Poland, and Uganda all receive some type of federal support for combating HIV. However, some of the nations definitely get more support than others. The United States gets a lot of funding from the federal government. It's in fact the majority of the funding for prevention and treatment. This example highlights this well, actually. The fiscal year 2021 budget proposal allocates about 716 million US dollars to the Ending HIV Epidemic Plan. Poland, however, as recently mentioned, is struggling to fund their HIV prevention and treatment programs. They have significantly less funding allocated to this disease compared to Western European countries. In Uganda, it's certainly true that treatment and public health initiatives are underfunded. They do utilize some small numbers of donors internationally, but these funds are inconsistent. In 2014, legislation called the AIDS Trust Fund was passed to try and support the National Strategic Plan. We did this by mobilizing domestic resources, but most importantly, adding taxes to bottled water and alcohol to raise money for this fund.